Before providing morning care, a resident tells the CNA they prefer to wash their face after breakfast. What should the CNA do? A. Explain that morning care must be done before breakfast. B. Respect the resident's choice and adjust the schedule. C. Ignore the request and continue the routine. D. Ask another aide to handle the situation. Answer: B. Resident-centered care requires respecting personal preferences whenever possible. CNAs should promote autonomy and dignity. A CNA finds a resident sitting on the floor after a fall. What should the CNA do first? A. Help the resident back into bed. B. Check for breathing and injuries, then call for the nurse. C. Report it after the shift. D. Move the resident quickly to a chair. Answer: B. After a fall, assess for consciousness and breathing. Never move the resident before reporting to the nurse, as this could worsen injuries. Which of the following is the correct way to measure a resident's radial pulse? A. Use the thumb on the resident's wrist for 10 seconds. B. Place the index and middle finger on the wrist and count for 60 seconds. C. Count beats for 30 seconds and multiply by 3. D. Press firmly with all fingers on the wrist. Answer: B. Use the index and middle fingers to gently feel the radial artery on the wrist for 1 full minute for accuracy. A resident with right-sided weakness needs to move from the bed to a wheelchair. Where should the wheelchair be placed? A. On the resident's left side. B. At the foot of the bed. C. On the resident's right side. D. Facing away from the bed. Answer: A. Always position the wheelchair on the resident's stronger side to promote safety and ease of transfer. During oral care for an unconscious resident, the CNA should: A. Use mouthwash only. B. Use a small amount of water and a sponge swab. C. Brush the teeth vigorously. D. Pour water directly into the mouth. Answer: B. Unconscious residents are at risk of aspiration. Use a sponge swab and minimal fluid to keep the mouth clean and prevent choking. A CNA notices a resident's dentures are cracked. What should the CNA do? A. Try to repair them. B. Throw them away and use disposable items. C. Report the damage to the nurse immediately. D. Ignore the issue if the resident can still eat. Answer: C. Damaged dentures can injure the mouth. Always report such findings to the nurse for repair or replacement. When helping a resident use a bedpan, the CNA should first: A. Close the privacy curtain and wash hands. B. Raise the head of the bed to 90 degrees. C. Leave the resident alone immediately. D. Ask another aide to assist. Answer: A. Protecting resident privacy and maintaining infection control are key before performing any personal care procedure. A resident who is usually alert becomes suddenly confused. What should the CNA do? A. Assume it is normal aging. B. Report the change in condition to the nurse right away. C. Wait to see if it improves. D. Offer more fluids only. Answer: B. Sudden confusion can indicate infection, low oxygen, or other medical emergencies. Always report promptly. Which is the best way to promote communication with a hearing-impaired resident? A. Shouting directly into the ear. B. Speaking clearly and facing the resident. C. Talking while turning away. D. Using long medical terms. Answer: B. Face the resident, speak slowly and clearly, and use gestures if needed. Shouting may distort sound and reduce understanding. A resident's care plan includes NPO. What does this mean? A. No private outings. B. Nothing by mouth. C. No patient observations. D. Normal physical orientation. Answer: B. NPO means the resident cannot have food or liquids by mouth, often before surgery or certain procedures. When performing hand hygiene, the CNA should wash hands for at least: A. 5 seconds. B. 10 seconds. C. 20 seconds. D. 1 minute. Answer, C. Effective handwashing requires scrubbing for at least 20 seconds to remove harmful germs and prevent infection. A resident says, "I don't want to live anymore." What should the CNA do? A. Ignore the comment. B. Try to cheer the resident up. C. Report the statement to the nurse immediately. D. Tell other residents about it. Answer, C. Suicidal or hopeless statements must be reported immediately for safety and emotional support intervention. A CNA observes a bruise on a resident's arm that wasn't there yesterday. What should the CNA do? A. Ask the resident to explain what happened. B. Report the finding to the nurse immediately. C. Wait until the next shift. D. Cover it with clothing. Answer, B. Unexplained bruises could indicate injury or abuse. Prompt reporting ensures investigation and resident protection. A resident on a low-sodium diet asks for salt. The CNA should A. Give a small amount. B. Say no and walk away. C. Explain the restriction and report the request to the nurse. D. Replace salt with sugar. Answer, C. Always respect dietary restrictions and notify the nurse if the resident requests restricted items. Which of the following helps prevent pressure ulcers? A. Keeping the resident in one position. B. Repositioning every 2 hours. C. Increasing bed height. D. Using plastic sheets directly on skin. Answer, B. Frequent repositioning improves circulation and prevents skin breakdown, reducing the risk of pressure injuries. A CNA is documenting care provided. Which is the correct method? A. Write in pencil. B. Document care before it is given. C. Record information immediately after the task. D. Leave blank spaces. Answer, C. Documentation should be done right after care to ensure accuracy and legal integrity. What should the CNA do if a resident begins to choke while eating? A. Perform abdominal thrusts if unable to speak or breathe. B. Offer water. C. Hit the back repeatedly. D. Wait for the nurse. Answer, A. If the resident cannot speak, cough, or breathe, perform the Heimlich maneuver and call for help. A CNA notices a spill in the hallway. What should they do? A. Leave it for housekeeping. B. Cover it with a towel. C. Clean it or report it immediately. D. Warn only the residents nearby. Answer, C. Spills pose a fall hazard. CNAs should clean or report them immediately to maintain safety. During perineal care, the CNA should clean. A. Back to front. B. Front to back. C. In a circular motion. D. From side to side. Answer, B. Cleaning from front to back prevents contamination of the urinary area with fecal bacteria. The most accurate way to measure body temperature is A. Oral thermometer. B. Axillary thermometer. C. Rectal thermometer. D. Forehead scan. Answer, C. Rectal temperature provides the most accurate reading, especially in residents with unstable conditions. A CNA witnesses another aide speaking rudely to a resident. What should the CNA do? A. Ignore the situation. B. Report it to the nurse or supervisor immediately. C. Confront the aide aggressively. D. Tell the resident to calm down. Answer, B. Verbal abuse must be reported immediately according to Virginia's patient rights laws and OBRA regulations. When transferring a resident with a weak left leg using a gait belt, the CNA should A. Stand on the resident's left side. B. Stand behind the resident. C. Stand on the resident's right side. D. Walk ahead of the resident. Answer, A. Always provide support on the resident's weaker side to prevent falls during transfers. A resident with diabetes refuses breakfast. What should the CNA do? A. Force the resident to eat. B. Report refusal to the nurse immediately. C. Remove the tray and forget it. D. Offer candy instead. Answer, B. Skipping meals can cause blood sugar problems. Report refusal promptly for nurse follow-up. A resident complains that their roommate is too noisy. What should the CNA do? A. Tell the resident to ignore it. B. Report it and help resolve the conflict. C. Yell at the noisy roommate. D. Move the resident without permission. Answer, B. CNA should address comfort concerns respectfully and involve the nurse to mediate if needed. When wearing gloves, the CNA must A. Wash hands before and after use. B. Skip hand washing if gloves are used. C. Reuse gloves for the same resident. D. Remove gloves after leaving the room. Answer, A. Hand hygiene before and after glove use prevents cross-contamination. The CNA notices the resident's call light is on, but the CNA is busy. What should they do? A. Ignore it until finished. B. Turn off the light without helping. C. Acknowledge and respond as soon as possible. D. Wait for another aide. Answer, C. Call lights must be answered promptly to ensure resident safety and satisfaction. When assisting a resident with a weak arm to dress, the CNA should A. Dress the weak arm first. B. Dress the strong arm first. C. Dress both arms together. D. Ask another resident to help. Answer, A. Dressing the weaker side first prevents strain and discomfort. The CNA must report which of the following immediately? A. Resident asks for an extra blanket. B. Resident refuses to join activities. C. Resident has difficulty swallowing. D. Resident wants a snack. Answer, C. Swallowing problems can indicate choking risk or aspiration. Report right away. When assisting a resident to eat, the CNA should A. Rush the meal. B. Offer large bites. C. Encourage independence and allow time. D. Feed without talking. Answer, C. Encourage residents to do what they can to maintain independence and dignity. A CNA spills a resident's urine sample. What is the correct action? A. Leave it. B. Clean the area using standard precautions and report it. C. Pour water over it. D. Ask another aide to do it. Answer, B. Use gloves and disinfectant, then report the incident for proper documentation. What is the primary goal of restorative care? A. To cure diseases. B. To help the resident regain independence. C. To limit movement. D. To reduce care staff time. Answer, B. Restorative care supports residents in maintaining or regaining physical abilities and independence. A CNA must renew their certification in Virginia every A. 6 months. B. 1 year. C. 2 years. D. 5 years. Answer, C. CNAs must renew certification every 2 years with proof of employment or training. A resident's care plan must be reviewed. A. Once a year. B. Whenever the resident's condition changes. C. Only at admission. D. Only by doctors. Answer, B. Any change in condition requires updating the care plan for accurate and safe care. What is the main purpose of a transfer belt? A. To restrain residents. B. To assist in safe movement. C. To control behavior. D. For decoration. Answer, B. Gait or transfer belts help CNAs move residents safely, reducing fall risk. When feeding a resident with dysphagia, the CNA should A. Offer thin liquids. B. Feed quickly. C. Sit the resident upright. D. Allow lying flat. Answer, C. Sitting upright prevents aspiration when swallowing. Which observation must be reported immediately? A. Slight loss of appetite. B. Sudden slurred speech. C. Refusal to join activity. D. Minor mood change. Answer, B. Slurred speech may indicate a stroke and needs urgent attention. Proper body mechanics include: A. Bending at the waist. B. Keeping feet wide apart. C. Twisting the spine while lifting. D. Holding items away from the body. Answer: B. A wide stance provides stability and prevents back injury. Which of the following is a violation of resident rights? A. Knocking before entering. B. Sharing medical information with family without consent. C. Providing privacy during care. D. Allowing residents to refuse meals. Answer: B. Confidentiality must always be maintained unless authorized by the resident. When removing dirty linens, the CNA should: A. Hold linens close to uniform. B. Shake them to remove debris. C. Roll them away from the body. D. Place them on the floor. Answer: C. Rolling linens away prevents contamination of clothing and the environment. Before leaving a resident's room, the CNA should always: A. Lower the bed, place call light within reach, and ensure safety. B. Turn off the call light. C. Close all windows. D. Raise the bed for next care. Answer: A. Ensuring safety before leaving prevents accidents and supports resident comfort.